As the world races for a COVID-19 vaccine, thousands are volunteering to expose themselves to the virus to help in vaccine trials. ABC 7's Michael Gordon introduces us to a woman right here in El Paso who is taking part in those trials. He joins us live now. And Michael, explain to us what a human challenge trial is and how it's different from more traditional clinical trials.
Absolutely, and this is very interesting. These are trials where you have volunteers who are deliberately exposed to infection. This is done in order to more aggressively study the disease and have more dynamic testing of potential vaccines and treatments.
I have volunteered to be infected with SARS-CoV-2.
Enter 67-year-old Elaine Goodman, a nutritionist and award-winning triathlete turned advocate for the group One Day Sooner and their plans for human challenge trials.
Because in conventional trials, it really does take at least 2 to 4 years to develop a good vaccine. But with human challenge trials, we can know inside of a month or two whether the vaccine candidate is going to work successfully.
The group was created back in April to help bring human challenge trials to the United States.
The United Kingdom is going to start their challenge trials in January, which is the first in the world, and then Canada will follow.
Most trial volunteers are between 18 to 30, but Elaine Goodman says she is uniquely qualified as an athlete to represent her age group and help further research efforts on seniors.
I felt that I would be a good example and a good study because of my health, and that's really the key for me. I have a really strong immune system.
Elaine and One Day Sooner have been contacting government groups and congressional leaders, including Congresswoman Veronica Escobar, about setting up the trials.
We want them to go ahead and speak to the FDA and the CDC, to mostly the FDA, to allow their regulators to go ahead and regulate human challenge trials.
Now, as to where these trials would be held, they're organized and set up to be done in secure biocontainment facilities. This would happen theoretically across the country in areas that would include select hospitals and possibly some military facilities. Stephanie?